Sorry for the interruption. I had someone open up the door on me. I apologize. We're getting right back to the exam. So as I was mentioning before, I am assessing for cranial nerve number 9 and 10. And again, we're going to be doing the gag reflex right now. Okay, so if you can open up your mouth. Okay, I'm going to look back here. Actually, I'm going to grab my, that's actually okay. Okay. Okay, I'm just doing chest back here. Okay, good. Okay. All right, good. Okay. That's good. We're gonna move on to cranial nerve number 11, which is I'm gonna be checking his shoulder strength. Okay, so I want you to shrug your shoulders up. Okay. And I'm going to put my hand on your face, and I want you to go towards my hand, okay? And I'm going to just kind of take your head and move it towards my hand. I'm going to be checking his sternocleidomastoid. Okay, good? Good. Okay, and then the other way? All right, good. And it seems like they're equal in strength as well. And then lastly, cranial nerve number 12 is I want you to stick out your tongue for me and say ah. Ah, okay. Then take your tongue and bring it to the side of your mouth. Okay, and then the other one. Okay, great, super. So that concludes the cranial nerves at this portion. So we right now what I'm going to do is I'm going to just start assessing his head and his scalp. I'm going to look over his skin, and during my whole assessment, between everything that I do, I'm always looking at his skin. Okay. So I'm just going to take a peek and see if there's any kind of lesions, any kind of open sores, masses, bumps, anything at all. Does anything hurt on you?
Mm-mm.
Okay,
No.
good. During this too, I'm going to be looking at the back of his ear because I know we didn't get to do that actually. During cranial nerve number 8, that's one thing I forgot to do. And I can do that right now because it's just quite all right. I am going to take a peek and look in his ears, okay? So I'm going to bring his ear, auricle of his ear, I'm going to bring it back and up, okay? And I'm going to, it's easier for me to go this way. I'm going to take a peek and look inside of here. And I'm looking for the tympanic membrane. And his tympanic membrane looks nice and gray and pearly. Doesn't look like there's any kind of perforation in there. This one's gray as well. There's a little bit of white as well in there. And you could also do that with a child as well. You would just want to maybe put them on their mother or father's lap. And if they don't like it, you can put them back on their back and keep their shoulders down and pin them down if you need to. So I'm going to now just continue to look through, feel his sinuses. Does this feel any kind of pain?
No.
Okay. Okay, and I'm going to pull down his conjunctiva, and they're nice and pink, okay? And again, I need to look at your nose, okay? I'm going to just look in that. Okay. That doesn't have any discharge, there's no swelling, there's no lesions, okay, that looks fine. And can you open up your mouth one more time? And I'm going to look around there. Tonsil, everything's nice and pink in there. Lift up your tongue for me. Okay, I'm just noting the color of his gums. He looks good. I don't see any kind of lesions in there, any kind of sores. So another thing that I needed to include on cranial nerve 9 and 10 was I need to include swallowing. So I'm going to check, actually right now I'm going to just kind of feel. Can you swallow? Okay, great. So you're good at that. So now I'm going to when you swallow, I'm going to ask you to swallow. I'm going to feel around here because I'm feeling your thyroid gland, okay? And can you do me a favor and swallow again? Oh, wow, okay. Okay, good. And I can also feel his trachea there as well. Okay, I'm also feeling lymph nodes around here. I don't feel anything that's swollen. He looks symmetrical to me, musculoskeletally. Okay. Okay. We are going to move on to the respiratory portion of our exam. So what we're going to do right now is actually, can you take off your shirt for me?
Mm-hmm. Of course.
I'll put it right over here. Okay. And we are going to, I'm going to palpate first, and just for lack of time, I'm going to palpate all around his chest, okay, looking for masses and any kind of pain that he would have, okay. Then I'm going to hold my arms back here, and can you do me a favor and just can you, I'm going to check for tactile fremitus. Can you say the number 99?
99. 99. 99. 99.
Okay, good. All right. And then I'm going to go ahead and I'm going to percuss his back. I'm going to do a bit each side. Okay. And then I'm going to do his front as well. Can you lift up your arm a little bit? Okay, and this one too. Okay, good. All right. So everything sounds great. I am going to listen to your lungs too. I'm going to listen to a total of 8 in the front, 8 in the back, and then a total of 4 on each side and side. So a total of 26 positions. So, okay, a couple deep breaths. Okay, and again, for lack of time, I'm not going to finish everything on the back. And I'm going to do on the front. Okay, and then I would do 4 more on that side. Okay, he sounds nice and clear. Okay, great. So now what I'm going to do is I am going to move on to the cardiovascular portion of the exam. So I'm actually going to have you lay down for this portion.
Put this down there?
Yeah, actually, can you stand up a little bit? I'm going to
Sure.
just bring this forward. Okay. There you go. Let's make sure that we can be seen. Okay. So first thing I'm going to do is I'm going to feel for his pericardium, his PMI. So sometimes you can see it as well. And I actually do right here, okay? So I'm just gonna feel here and right over here on the edge of the sternal border, and then also the base as well. I'm gonna listen for the 5 different aspects of the heartbeat, and the first one I'm gonna listen for is the aortic. And then the pulmonic. The second pulmonic, the tricuspid, and the mitral. and they all seem regular. I am at this time, since I have him laid down like this, I am going to listen to his carotid. I'm going to first palpate and then palpate his carotid arteries. Okay, they're symmetrical. And then I'm going to listen for a brute. Good, there doesn't sound like any kind of obstruction there at all. Okay. I am going to move on then, since I'm going to move on to his abdomen at this time. And the first thing I'm going to do is I'm just going to observe looking at it right now, okay? I can see a little bit of a pulse coming from his aortic artery right in the middle. And then I'm going to go ahead and I'm just going to listen at this time. I'm also going to listen above the liver on the right side here. And I'll listen above the spleen as well. Actually, I'm going to have you, well, we'll wait just a little bit. Okay, so what I'm going to do now is I'm going to actually percuss your belly. Okay. We're going to go ahead and look over your liver as well. Put your hand down. Your spleen. Okay, and then can you take a deep breath for me? Okay, one more. Okay, and I don't feel an enlarged liver. Okay, and then can you do another favor and take a deep breath for me? Okay, and let go. Okay, and I don't feel an enlarged spleen there either. Okay, I'm just going to listen. Listen for the, actually before I listen, I'm gonna palpate his belly very softly, gently. Noting anything on the top. And then I'm gonna do it a little bit more deep. Is there any kind of pain? I don't notice any kind of masses. Okay. And then I'm going to listen for the aortic artery here. See for any brutes. The renal. The iliac. And then the femoral. Okay. I'm going to have you sit up right now. And while you're sitting up, I forgot before to check your expansion. So if you can take a deep breath for me, I'm just going to check your lung expansion. Okay, and then let it go. Okay, so that's symmetrical. And then I forgot to check your kidneys as well back here. So tell me if there's any kind of pain.
No.
No? Okay, good. Okay. And then I am just going to percuss back here too. Okay, good. I'm going to continue on just looking at his skin everywhere. At this time, we're not going to do the breast exam. Like on a woman, if I had a woman, but I would look for just observation. I would look for symmetry. I would also want to palpate to make sure there's not any lumps, any kind of discharge coming from the nipples, any kind of irregularities with the areola. And then we would also do the genitalia as well. And again, we would not be looking for, or we would not be, we would not want any kind of discharge, any kind of, lesions down there, either externally or internally. If we did the woman's exam, we would want to see a pink cervix. On the outside, for male and female, even hair distribution. And again, they're no kind of looking for STIs, nothing like that, okay? So just keep on looking down. I'm gonna look at his feet as well. I'm gonna feel also for any kind of, that they're nice and warm to touch as well. I'm gonna be just double checking capillary refill on both of his hands and his feet as well, okay? I am going to start with range of motion now for the musculoskeletal. For the musculoskeletal portion of the exam, I'm just looking to see that everything is aligned, okay? I can see that it is, it's symmetrical, everything. I also want him to take his fingers, and then, actually you can bring them this way, and I want you to test your fine motor skill. So bring your thumb to your fingers, and then bring it back. Okay, very good, okay. And then we're gonna test your, that's good, you can just relax. I'm gonna test your strength. So we'll just, you can hold my hands and squeeze, okay? And then I want you to put your hands up and push them up against mine, okay? Push them down against mine, okay? Bring your legs, trying to push them towards you, okay? And then try to push them away. All right, good. He's got very good motor strength as well. Range of motion, I want you to take your head, bring it up, bring it back, okay? And then I want you to turn to the side, okay? And then just like this to the side as well. Okay, good. Then you can bring your arms and you can bring them up and you can bring them down. You can bring them back and hyperextend them. Good. You can bring them up again and then you can flex them like you get big muscles. Okay, and then bring them down. For your hands, you can bring your wrist down. Good. Okay, and then bring them all the way around. Okay, good. And then your fingers, you bring them apart and together. Good. Make a fist. Okay, super. Bring your legs out. Okay, good. And then can you take your ankles and bring them down? Good. And then you're kind of circle them around. Okay, good. Can you bring your leg out? Okay, what about the other one? Okay, super. Okay, super. Good range of motion. Great. So then musculoskeletal, then I am going to I want you to just close your eyes, and I'm gonna take this tongue depressor, and I'm gonna go with his distal, cross your feet, and tell me if you can feel this, and tell me where.
On my toe.
Which toe?
My big toe.
Okay, what about this?
At my bottom of my foot.
Okay, which foot?
Left foot.
Okay, with this?
Right foot.
Okay.
And my right big toe.
Okay, good. And?
My left arm.
Okay. And?
My middle finger on my right hand.
Okay.
And this finger on the left hand.
Okay, good. Keep your eyes closed. And I'm gonna put this in your hand and tell me what this is.
Rubber band?
Okay, good. Put your, in this hand, what is this?
I think it's a pen.
Okay, good. All right, you can open up your eyes now. And that looks good. I'm going to test your reflexes now. Okay, just relax, okay? Okay. Okay, good. Just relax. Okay. Okay. All right, good. Okay. I'm going to give you his shirt, and then we're going to have you walk a little bit.
Okay. How far should I walk?
About 20 feet. So you
Okay.
can walk to, like, around the door and walk back.
Okay.
Then I'm going to move this. I'm looking for heel to toe movement, okay? And then I'm also gonna be looking for your spine, so let's close this up again. So you did really good with that.
Thank you.
And you can just stand right here,
Okay.
okay, and then turn around. And then I'm gonna have you, actually what I want you to do before we do that, put your feet completely together
Okay.
and close your eyes.
Okay.
Okay, and I'm just gonna watch. Okay, good, and he's nice, he doesn't wanna move at all for hearing, I forgot that one too. So, okay, you can open.
Okay.
So now you can put your feet apart and you can bend over slowly, and I'm gonna look at your spine.
Okay. You want that shirt off?
Nope, it's fine. Okay, and he looks good and symmetrical. All right. Good. Good. All right. Well, I think that that completes our physical assessment for today. Thank you so much. Have a great day.